So I'll answer it first directly, and then I'll talk a little more broadly about the policy. It is certainly the case that it's a policy which could lower drug prices. There's a question of how much. Usually what happens in policies like that is the high-paying country, in this case the United States, would end up paying somewhat less, but the point here to understand is the low-paying countries would pay somewhat more. The question is, where in the middle would we end up? And then there's a whole slew of potential unintended consequences, which I think we can enumerate, but we may not be able to quantify. A good example would be what it does to innovation in pharmaceutical areas, how it influences other types of contracts that are going on in the United States outside of Medicare, as there's a whole bunch of moving pieces that change in response to any particular policy change. So what it does to patient access, a whole bunch, what it does to drug shortages. There's a whole bunch of questions that arise in these types of policies. In fact, there's even broader ones related to the politics between us and other countries. How do the Europeans react now that there'll be upward pressure on their prices if there's somewhat downward pressure on ours? So I think certainly it could lower our drug prices to some extent, but it's not a simple quick fix to the problem. And what we have to understand, I think, broadly is we're in an era where cost containment has become so important that one way or another we are going to control spending. And the challenge is to find the way to do that which is the least deleterious. And I am not sure in this particular case how that balance plays out, but we shouldn't think of this as might it work or might it not, which is obviously a reasonable question, but relative to what? It's not clear that the status quo is the right alternative. So we'll see what happens. I wish I could give you something more insightful.